Welcome to Your Health. I'm Lisa Hart. Memorial Care and Laguna Woods Village have formed a collaboration to better serve the residents of Laguna Woods Village. Today we brought together Barry Arbuckle, President and CEO of Memorial Care, and Jeff Parker, CEO of Village Management Services, to discuss the collaboration between the two, as well as the importance of seeking medical care when you need it. Thank you for joining us.
Thank you.
Thank you.
So Barry, we've had you here before, and Jeff, we've seen you many, many times. But nonetheless, let's talk about a little bit about your backgrounds and sort of what is happening with Memorial Care right now. Barry, I'll start with you.
Well, wonderful. Thank you, Lisa. It's great to be back. My career with Memorial Care goes back over 30 years. I started in our children's hospital up at Miller Children's at Long Beach Memorial, and have just moved through the organization over the years. In the late 90s and early 2000s, I was the CEO at Memorial Care Saddleback Medical Center, and in 2002, I became the CEO and president of the health system. So it's been a career at Memorial Care.
It sure has. It sure has. And Jeff, why don't we have a background from you too?
Well, I've been here now for a year and a half at the Village. And prior to that, my experience comes from local government. I've been a city manager for over 25 years, and the last 7 years in a community just down the road, Tustin, California.
Well, excellent, excellent. We'll welcome both of you again. Barry, can you give me a little bit more information about how Memorial Care has grown and served the residents here in Orange County? I mean, I know it's been around for quite some time.
It has. We've got a great history with Laguna Woods Village, actually dating back over 50 years, when the residents decided they wanted a hospital nearby. And as I'm told, collected money in coffee cans going door to door, donated 9 acres across the street where the hospital sits today. In fact, I'm told that your Community Center 1, I believe,
Clubhouse
1 was used as a medical clinic and a pharmacy while the hospital was being constructed. But since then, we've expanded. Memorial Care has over 200 locations now, from our hospitals to our physician offices, urgent care centers, imaging centers, surgery centers, dialysis centers.
Wow, that's a lot. That's a lot of stuff. And I'm glad that you're able to help our residents even more with more services like you mentioned. Jeff, how has the collaboration between Memorial Care and Laguna Woods, helped aid the residents?
Well, a couple things. It's been great partnership to begin with. And Barry's organization has been such a contributor to the Village. It's very much appreciated to start off with. Thank you. In the area of social services to begin with, we have had a partnership in which Barry's organization has supplied a social worker to work with our organization and our social team to address fall prevention issues and coordination between our residents who go in for care at their facilities and then are coming back to their homes and need to make sure that they're in a safe environment. So that part of our social services is very, very important because that transition back into being here at the Village is so critical and providing good care to our residents.
Right.
Then on top of that, they've become a premier leader in our partnership with our Village Breeze, which is our new magazine. And so their leadership in that and their contributions in that is just phenomenal to make that something that we really have worked hard to get out to our residents, and having a hard copy magazine. So with just a plethora of information in it, and with their contribution, that's made that possible. With that, the other things that they've contributed is mask distributions, which has been critical, as I've mentioned a number of times, getting masks out, food distribution.
Right.
All of those type of things they've just really stepped up. Anytime that we've asked for emergency help or engaging our residents here for needs, Memorial Care and everybody in his organization have stepped up.
Yeah, and boy, we needed a lot of masks too. We had about 20,000 masks distributed, I believe. So it's been great, and everybody's been doing a really good job with those. So excellent. All right, good. So what I'd like to do is we're going to go ahead and take a break, and then when we come back, we will talk a little bit more about the services that have resumed with Memorial Care.
Very good.
Okay. All right. And we'll be right back after this.
Hello, I'm Barry Arbuckle, President and CEO of Memorial Care. This important message is for our patients, employees, physicians, and our community, and it must not wait. Together, we have flattened the COVID-19 curve by social distancing and other measures. Together, we have prepared for the possibility of a surge in hospital patients, which thankfully we haven't experienced. And together, we have continued to provide exceptional, safe health care to a small percentage of patients who have the virus and many others with healthcare needs completely unrelated. Together, we must now focus on renewal. Renewal of healthcare services and, most importantly, the renewal of your healthcare. I know some of you are reluctant to seek care as our community adjusts to reopening. You may be ignoring symptoms or delaying important treatment. This is worrisome. Delays can lead to worsening of serious medical conditions, even unnecessary loss of life.
I'm Dr. Mark Sackwood, Chief of Cardiovascular Surgery for Memorial Care. I just completed a minimally invasive aortic valve replacement. This patient had aortic stenosis with increasing symptoms of shortness of breath, chest pain, and dizziness. Without surgery, there could have been dire consequences, including potential loss of life. If you have symptoms, please don't delay your care. We are here for you.
Oftentimes, conditions like the one Dr. Sackwood just described are discovered in one of our 4 hospital emergency departments. We know of instances in which patients have delayed going to the ER when they needed to be there.
I'm very concerned that patients with stroke, heart attack, sepsis, or other medical emergencies are delaying care. Let me reassure you, it is safe and critically important that you do not ignore the signs and symptoms such as chest discomfort, shortness of breath, difficulty breathing, or sudden onset of headache. If you think you may be having a medical emergency, don't wait. Call 911 or go to your nearest emergency room.
Welcome back. We have been at stay-at-home orders for quite some time. But today we're going to talk about some of the many hospital services at Memorial Care Saddleback that are going to be opening or have already opened here in the next couple weeks. And that's to include MRIs, x-rays, elective services, and a variety of other things. So Barry, with that said, I know it's been tough for, 10 weeks I think it's been.
It's been long.
And there's a variety of things that you would like to tell us about that were already happening, as well as what's coming down the pike.
Absolutely. You know, first, what I'd like to do is commend the residents of Laguna Woods Village. You did a remarkable job with social distancing and other measures to stop the spread of COVID. Orange County and this community did an unbelievable job, and we're so thankful for that. But now the important thing before us is what we're calling renewal. Renewal of healthcare services and renewal of the community's health care. I know folks are a little reluctant, maybe even scared to come into a medical facility. The concern though is people are putting off their preventive care, their follow-up care, even things that are emergent. We've had cases where folks have had a heart attack and 3 days later came into the doctor and the doctor could tell they'd had a heart attack, but were afraid to seek services. Right. And I just want to reinforce the facilities are safe, whether they're the hospitals, the urgent care centers, physician offices, the ambulatory centers. We follow very strict protocols on sanitation. We have our waiting rooms designed so that we can have social distancing.
Right.
So it's really important to the community that they seek care that they need, because we want to be the healthcare provider for the community.
So Jeff, during those weeks that we were at stay at home, did you get a lot of feedback from some of the residents who were fearful? And did they have a lot of questions?
Yeah, we have been in communication. That's one of the critical things that we've done in this period of time, is that we've tried to get communication out to them via email blasts on our Friday activities or in the briefs, as we talked about in the magazine, but really trying to communicate via TV6. You and I have had the opportunity to sit down 3 times a week, basically, right, to communicate not only what are the stats that are coming out from the county, but also providing additional information like that they should go in and get care, that there is the protections in place. Right. And what we're doing here at the village like Barry indicated, which is so critical, making sure people are wearing the mask, making sure our operations are meeting those COVID-19 requirements, such as our busing, where we're requiring people to wear a mask and social distancing. And so to just pounce on that comment was that the village has done such a great job that in the community as a whole for Laguna Woods, we still only have 10 confirmed cases,
Right.
which is only one of 4 communities, all of Orange County, that has that low of threshold. And my hands off to everybody in the community. They've done a great job following the rules, listening to us, and as we reopen our facilities, we're going to have certain conditions on that so that we can continue to protect them as we move forward in opening up.
Right. And at what point did you notice it was going to be an issue where fear and reluctancy to come in?
You know, I think early on we had reports of folks that needed to come in for a procedure, even during the stay-at-home orders or the quarantine time, and they were just reluctant to do so. And so now that we've resumed all services, we're doing all services now at all the locations, the residents should feel safe to come in and seek the care that they need.
Okay. Okay. Well, that's good. And then let's talk a little bit about, so all services are open and you've pretty much, you can take anything at this time?
We can, yeah. We've
Okay.
resumed all services. We followed the governor's orders by opening up slowly with kind of the more critical elective procedures that were put off, but we knew they couldn't be put off too long.
Right.
And have now resumed all services at all of our locations.
All right, excellent. Good to know. So now we can report that now. Hopefully we'll get back to
great.
talking to more of your doctors. One thing I wanted to talk about is safety. We did have the pleasure of speaking with Dr. Taub in your ER department, and
He's a
he's
gem.
great. He just wants to bring around his little cart and show us everything in the ER, you know, how clean it is and how designated it is. So you guys really did a good job, and you did it very early on of how you separated COVID-19 folks from folks who weren't dealing with that.
Yep.
So what did you want to tell our residents about that situation, on things that you've done at the hospital to make them more comfortable?
Well, you mentioned Dr. Taub's work, and he actually was a model for our entire health system in the way we have the different zones, as you mentioned, the suspected COVID, the uncertain folks, and the folks that we knew did not have COVID-19, and had them completely separated. We are now, as we bring folks back into the facilities at all the locations, the hospitals, the physician offices, urgent care, ambulatory centers, we're going through very strict protocols. Folks are being comprehensively screened. They're having their temperature taken, and then they're being given a mask. As I mentioned, our waiting rooms have all been redesigned to have proper social distancing, like Jeff and I are today. And we're following the strictest standards of cleaning and sanitation, again, at any of the facilities, because people think about healthcare, they first think of a hospital, which is important, but most healthcare happens outside the hospital.
Right.
And we're following the exact same procedures outside the hospital as we are within the hospital. So I just want the residents to know it's safe to return and seek healthcare services.
What happens if someone has a someone who is helping them? Do they come in with the patient, or is that still not an option?
If they need the assistance, we can arrange to have them join the patient. Right now, we're kind of slowly letting visitors back in, just trying to do it in a very measured pace, just so we can maintain the wonderful outcomes we've had in this community.
Okay, all right. And then, Jeff, let's talk a little about some of the safety precautions. You did mention the buses. What are some of the other things? I know you had additional disinfecting and a variety of those things that were going on. Tell me about that.
So when we first closed our facilities, clubhouses in particular, we went through a very deep cleaning process with every clubhouse, making sure that it had been disinfected and cleaned so that we weren't going, now that we're going to have it shut down for a little while, we wanted to make sure that when we start to reopen that they are in tip-top shape and clean and not worrying, anybody's going to worry about contracting the COVID-19 virus at that point in time.
Right.
We continued to do that throughout United and Third with critical areas of special cleaning. One in particular is that we have a lot of laundry rooms throughout the village. And one of the things that we did was we stepped up and we're doing twice as much cleaning and disinfecting in our laundry room facilities throughout United and Third compared to what we were doing in the past.
Right.
With regards to the buses, as I indicated, we're asking people to wear masks when they get on the bus and social distancing. If they're at the bus station, they don't have a mask, we have extra masks on the buses
Right.
for our drivers to give that. So we're asking people that they do that in order to get on the bus route. With regards to programs that we're doing out there, like tennis and golf, it's the registration process. In the case of golf, when you show up to the golf course, you should be wearing a mask. Once you're on the golf course, then you can take that mask off because there's enough social distancing and you're outside. So we're balancing that out, watching the protocols coming out of the state of California and Orange County, and making sure that we're following those protocols. And then we're also using expertise from, like in tennis and golf, from their national associations.
Right.
What are recommended. So
Right.
our next step is, again, to be very cautious and proactive when we open these up so that we're protecting our residents as much as possible.
Feedback from your doctors and nurses who are seeing many of our residents, anxious, they want to get back into the same routine they were in before with golf, with tennis, all those types of things. What's some of the advice that your doctors and nurses are giving the patients?
Well, I think the social distancing is absolutely key. The masks are important. Washing hands is absolutely key. I mean, it's all rather simple, but sometimes we forget to do it. A habit that I occasionally have, particularly if I'm on a long telephone call, is putting my hands near my face. That's a no-no.
Right.
So just some simple things along the way that can make a world of difference.
Okay. All right, excellent. And I know we've been going over the social distancing. We have educational slides for them as well, as well as wearing masks. One thing that I don't know if you mentioned was food distribution. So in the towers, they did a whole different thing. They had different types of ways of people having food.
Yes, at the tower specifically, they did a different type of distribution because they have more people there that are using their facilities for their food. And also, we started a program with Memorial Care where when we had some needs originally for people to get food to them, going to the market, getting people serviced with regards to getting groceries. And then we also partnered with Stater Brothers and contacted them, made sure that could we run a program and making sure that our residents were able to get over there early. So they opened up early in the morning for our seniors. And again, it was all about using our social services in combination with that to make sure that the needy, the people that can't get out there, that they're being serviced. And those that are in the village have access to Stater Brothers in a quicker, more efficient manner and not running into everybody like when you have to go during the middle of the day.
Right. Question for you, how has this changed how you move forward in planning for these kinds of things?
Well, probably most of the communities throughout the country had never heard of what PPE, personal protective equipment. Everybody knows what it is now. Hospitals kept, a supply on hand, but not nearly enough because we always had the distribution channels that could get them to us quickly. But we've seen what happens when those distribution channels shut down.
Right.
And so we actually, in the middle of all this, we acquired a warehouse to have additional supplies just in case something like this or similar to this happens again.
Yeah, a real eye-opener, huh?
Yeah, it really has been. It really has been.
And then as for you, probably never being in this situation before, how has it changed how you will operate going forward?
Well, a couple things. One, same thing, distribution. Making sure our warehouse has the PPEs for our employees is critical because we still have a lot of activities that are outside operations like landscaping and plumbing and where we're going into units. So we had to make sure that people were well prepared and protected, not only for themselves, but talk about the concern that the residents have when we say, hey, we have to come into your unit to fix something.
Right.
Well, they're very, very scared of that at the very beginning. They're getting more comfortable with it because they know we're wearing the appropriate care and equipment. I think the other thing is we're changing our operations as far as management at the facility here. We're doing a lot more telecommunicating. Right. And so our employees are staying home and working. And so working in that new world for this organization is something different. We were all hands-on before, and now we have a number of our employees that are working from home. So getting adjusted to that style has been kind of critical for us. Okay. And something that we look forward to using it as a potential benefit going forward and how we can be more efficient with it.
Okay, well, perfect. Well, we're going to take another break and we'll come right back.
Great.
All right, when we come back, we are going to find out some new services that Memorial Care will be providing. Stay with us.
We want you to be safe and feel safe. That is why Memorial Care is taking every possible precaution to ensure a protected environment for all patients, whether they're in one of our neighborhood health centers, urgent care centers, imaging or surgery centers, or our hospitals.
Memorial Care hospitals and outpatient centers are once again performing scheduled surgeries and procedures covering many specialties, including joint replacement, spine surgery, gynecological procedures, and many others. And we are taking many extraordinary precautions. All individuals entering any of our facilities are screened for symptoms, their temperature is taken, and a mask is provided. All surgical patients are tested for COVID-19 before their surgery. Waiting areas have been reconfigured for social distancing, and we continue to follow the most stringent compliance with disinfecting and cleaning of all equipment and spaces.
These types of precautions are taken in all of Memorial Care's locations, regardless of the service being provided. And remember, most health care isn't provided in a hospital. Memorial Care offers the greatest number of options for outpatient, neighborhood-based centers in our region. You can have your primary care and urgent care visits in person or virtually. Outpatient surgeries and imaging tests can also be performed in any number of our outpatient centers.
All of our outpatient centers stand ready to care for you. Whether your child needs a vaccination, you have a chronic condition like diabetes or high blood pressure, or whether you need an imaging procedure for a sports injury. Whatever your need, we're here.
Memorial Care is deeply committed to providing our employees, our physicians, and our community with exceptional and safe health care today and every day. Please don't neglect your health. You can rely on us as you always have. Thank you for the trust you place in Memorial Care and the honor of serving you.
Welcome back. Well, making your health care a priority, Memorial Care has dedicated some new services for you, and Barry is going to explain to us what some of those new services are. How exciting!
It is exciting. Actually, we're very thrilled. As of July 1, we're going to have a dedicated phone line exclusively for the residents of Laguna Woods Village.
Okay.
It'll go into our navigation center where all calls for the health system go, and residents can call for any number of services. Telephone advice from a nurse. We have nurses there 24/7. Scheduling an appointment in a physician's offices, including the one just up the street in Laguna Woods on the corner of Moulton and El Toro,
Okay.
Or scheduling a virtual visit or a televisit, which is something we have seen a striking increase of over this pandemic. In fact, we were just about halfway through a 3-year plan to bring on virtual services and had begun to do televisits relatively slowly. When this pandemic hit, our teams came together, and in a matter of days, we started doing what amounted to thousands of televisits. And I think that's something that's going to stay because there's a lot that can be done. We've got urgent care visits virtually, which is pretty amazing. So we just want to make sure the residents know that is available to them. I believe the telephone number and the website are on the screen.
Perfect. And so this will be dedicated just to Laguna Woods Village residents, is that correct?
Absolutely, yes.
Okay.
Yeah.
When you talk about, a televisit or telehealth, you mentioned that you were already in the process of going that way. But then because COVID-19 happened, it happened pretty quick.
It did.
But I understand that was also because insurance companies got involved because there was no code for it. So tell me how difficult or not difficult that was to make a code for it.
It was interesting, and I must commend both the federal government, CMS, that covers Medicaid and Medicare, for immediately putting codes in to reimburse for a virtual visit, the same they do for an in-office visit.
Great.
And the health plans followed suit. And we're hopeful, we're getting good signs from both the federal government and from health plans that will continue.
Okay, good.
And it's interesting, when I mean, years ago when I thought of a virtual visit, I kind of pictured a nurse or a physician at home, maybe in his or her pajamas, going through telephone calls with a patient, and that's not it at all. Sometimes they're in their office, sometimes
Right.
they're not, but they go in, they're checked in by a medical assistant, they get into the MyChart, which is our electronic medical record, they're put in a virtual waiting room, and when the physician's available, they're let in that waiting room. I mean, it's a very involved process,
Right.
and it's all cyber secure, which is critical these days.
That's good. Well, it sounds wonderful. So what do you think the residents are going to think about a dedicated phone line?
Well, I think they're going to be real excited about that. I think that's one of the things that is the connection between Memorial Care and the village. It's just going from the history that Barry talked about at the very beginning and just enhancing that now and saying, you're critical to us.
Right.
And we want to make you special. And I think a dedicated phone line, I think it's the responsive thing to do, but more importantly, it's good management practice. And so I applaud them for doing that, and I think our residents are going to be real excited.
Excellent. And then you have a little bit of a campaign going, We're Here. So your website, /We're Here, what are you trying to say?
Just to let the residents know that healthcare services are ready to be provided for you, regardless of what you need. Again, a lot of folks just think of the hospital, but our health system is much more expansive than that, and we're all ready for you to seek out those healthcare services.
All right, well, excellent. Well, we appreciate the fact that you are working so closely with Jeff and Laguna Woods Village executive staff to make it happen.
Yep.
I mean, it's an important time for sure to make sure everybody does know that you are there for them. So
Absolutely.
that's excellent.
That's exactly.
Any last words?
When this pandemic started and the term, but again, none of us used previously, social distancing became quite popularized. I wish they would have used the word physical distancing, because what we want to emphasize, particularly during folks being at home for so long, that they need that social connection. And so I mean, a lot of us have used Zoom or Facebook or Skype to keep in contact with family and friends. I encourage people to continue to do that. If they know someone that lives alone, reach out to them so they have that social connection, because it is very, very critical for folks.
Yeah, well, I know everybody that I've talked to can't wait to hug somebody again.
You're exactly
I suppose
right.
even though you have your masks on, you can still do somewhat of a hug.
I suppose you can, or an elbow bump, or any number of things.
Some kind of physical touch.
Exactly.
How about you? Any last thoughts?
Well, I think that's a good point. I think that people are wanting to become more, we're social animals, so we want to be out there. For us, I think it's really a focus going forward with regards to what kind of facilities and how fast we can get some of these open within a safe environment.
Right.
We certainly have gotten our tennis and golf and pickleball going. Our outside activities will start to increase more and more. I think that's going to allow people to get out there and do that socialization. We just want them to be safe and in a secure environment when they do it.
Exactly, exactly. Well, thank you both for joining me. I appreciate all the information, and I'm sure our residents will too.
It's a pleasure. Thank you.
All right. And remember, it is okay to go to the hospital or go see your doctor. They are well prepared to take you in and help you out. Join us next time as we discover more about your health.